This segment of DelmarvaLife is sponsored by TidalHealth.
So before we move on with the show, do me a favor, just stop and take a deep breath. Your lungs do a lot of hard work for you. When it comes to the respiratory system, it's a sad fact that nearly everyone, me and you included, knows someone suffering from pulmonary disease.
And this week happens to be Pulmonary Rehabilitation Week. So to help us breathe easy and live more freely, we called in one of the experts on the matter. We'd like to welcome in Susan Candela. She is a physician assistant with TidalHealth. Susan, thanks for joining us.
Thank you for having me.
So first of all, tell us about the lung surgery program at TidalHealth.
So we introduced robotics. Normally it was just an open procedure, but robotics came out a few years ago. It's been about 10 or 15 years. Dr. Wayberg brought it to TidalHealth, and now Dr. Baker and Dr. Connor are surgeons here. So robotic surgery is minimally invasive. So we cut in 5 little ports, one for the camera, a couple of assistant ports, and we take out your lung and lymph nodes, and it gives us a good staging, and we do that. It usually takes about 2 hours. Recovery time is much less. We usually have patients out maybe 1 or 2 days.
That's incredible.
Yeah. The confounding factor to all of that is if patients have bad COPD or emphysema, if you can imagine trying to staple across wet tissue paper, patients with COPD have very fragile lungs. So most patients can get out in 1 or 2 days, but sometimes it takes a little bit longer, but eventually those chest tubes do come out.
So you're talking rehabilitation to recover. Good grief, how crucial is rehabilitation, since we're especially talking about pulmonary health?
So we encourage patients to, after their surgeries, to get up and walk, right? Taking those big deep breaths after surgery is crucial to get them back on home, just on room air. Pulmonary rehab, they'll put an oxygen monitor on your hand to make sure that, you're not desaturating while you're exercising. They put the EKG monitors to make sure your heart's doing okay. So they're monitored pretty well when they're doing this.
So these patients, just had lung surgery after having issues with their lungs for a long time, might be a little hesitant to do the rehabilitation.
They're very well monitored, so I wouldn't be scared of doing that. I think a lot of times, and I've run into this a lot, patients who've had a smoking history and they undergo lung surgery, there's always the guilt factor that's in there, and I always look at my patients and say, if we all got what we deserve, we'd all be dead. So it's kind of putting them at ease that, we're all flawed and we all make mistakes, but here we are, hopefully we'll be able to get you out of the hospital quickly and safely, and going under pulmonary rehab is just to get their lungs, emphysema is emphysema. We can give medications to kind of make them feel a little bit better, but if you don't quit smoking, it only gets worse. So we really encourage them to quit smoking and then exercising. It does very much for them.
Okay, so we've got you here. Can we ask you real quick, what about the CDC lung cancer screening?
So we actually, it's NCCN guidelines. It's the National Comprehensive Cancer Network that we use their guidelines for this. Okay. There's the primary indications and secondary indications. Primary indications for getting surveillance. If you have a smoking history of greater than 30 pack years, so it's either 1 pack a day for 30 years, half a pack a day for 60 years. That's kind of how we figure in pack histories. And you are a current smoker or haven't quit smoking for 15 years or more, those patients are very much encouraged to get annual low-dose CAT scans.
Okay.
Okay.
And the secondary indications, we don't use these as much, but it's if you're greater than 50 and you have a 20-pack year smoking history or more.
Do you hear back from patients who have successfully completed pulmonary rehabilitation?
Well, I follow patients after their lung surgeries, and I actually do they get CAT scans yearly. First it's every 6 months for 2 years, and then it's annually after that. So we do see them back. And generally speaking, if they do well on that, then they can continue that on their own using their sentinel spirometry, walking and doing all of that. And they do pretty well with that.
That's good.
They've got tools, they can do it.
They do.
Susan, thank you so much for coming in
You're very welcome.
this afternoon. Very interesting.